Okay, trouble for Bernie Sanders' campaign. Labor union workers, they're a big Democrat base. They protested and disrupted Bernie's speech on his government-run health care plan. It was at a union event in Las Vegas. About a dozen union members started heckling Bernie Sanders. Watch.
For all, people will be able to go to any doctor they want, go to any hospital that they want. Now, let me deal with the issue that's on your mind. Because...
Okay. You hear that? They're saying union health care, protect union health care. And how do you pay for it? Look who's here. Heritage Foundation's Joel Griffith. Great to see you, Joel. Did you expect to see labor workers, union workers disrupting Bernie Sanders' speeches?
It was a bit of a surprise, but I thought eventually it would happen because as people catch on to what this plan for do, people are rightfully concerned. And it's not just about the cost. And make no mistake, the costs would be a big additional tax on regular workers. But it's really the lack of control, the fact that people are going to give up control over their own health care decisions and put that into the hands of the federal government. That is really starting to trouble people, as it should.
So we're in a brand new world. Bernie Sanders campaign, Elizabeth Warren campaign, now marching right into the buzzsaw of negative reaction from the labor unions. Here's why they're angry. Tell me if I'm wrong, that if Sanders and Warren do a government takeover of health care, it would wipe out the union's own health coverage. The unions use their health coverage as a big bargaining chip with their bosses. They give up a lot in the way of wages in order to get better health care. If they know that if they get stuck in the same government DMV line as everybody else, bosses may stick them at lower wages. Your reaction to that? Are we off base here?
No, they will be stuck with lower wages because as of now, the health care benefits are tax deductible to the employer. And actually, I should say to the employee, if you receive $500 worth a month of health benefits from your employer, you don't pay tax on that. You're going to lose that tax advantage. But you're talking not just union members that are going to lose this. We're talking 164 million Americans that are covered by employer health plans, the vast majority of which are people like myself that are actually quite happy with the health care that we have. We are all going to be forced onto a government system, the same government that mismanages the benefits to veterans. And if you talk to a veteran, ask them, how do you like your VA? A lot of them that actually are in need of surgery, in need of care, they're suffering right now. And furthermore, look at what's actually going on in Europe. Look at the wait times in Canada. Look at the wait times in the UK. And then look at the tax burden that the middle class is saddled with across Europe. We want a European-style welfare state. You're going to have to pay European-style taxes. And you're talking 50% plus payroll taxes like you have in France, or a whopping sales tax nationally.
Exactly, value-added taxes. Elizabeth Warren saw her national support cut in half in just 1 month after she announced what we call her Rubik's Cube plan to pay for government takeover. International Association of Firefighters, they don't like what Bernie and Elizabeth talking about. They've endorsed Joe Biden. I want to get to this quickly. Look what Goldman Sachs is now finding in terms of the rapid increase in blue-collar wages, up 4.3%, the fastest pace since the financial crisis under Trump. This is at near the peaks of the 1990s expansions when we had a dot-com internet boom. It outpaces the 3.3% average for all other workers. Blue-collar wages accelerating, Joel.
Yeah, these are big data points here. We see wages accelerating across the board on all income levels, but those at the bottom tier, they're seeing their wages increase at a faster pace than anybody else at a rate nearly twice the rate of inflation. And I think it's important to point out this isn't just over the last month or the last quarter, even though those numbers have been good. This has been going on now for several years. We are at an all-time high in household income. And you go back 40 years now, if you look at the percentage of people that are in the upper class and the upper middle class, that has grown dramatically over the past 40 years, and we're seeing a continuation of that.